Let me excuse myself. I'll be a kind of a maverick without PowerPoints. I'll present something on behalf of UNODC. First of all, Namaskaram and Suprabhatam. No? I'm truly delighted to be here amidst such a distinguished gathering in God's own country, Kerala, as the regional representative of UNODC. As you may be aware, the United Nations Office on Drugs and Crime assists member states in their struggle to combat illicit drugs and international crime. Over the past 2 decades, the UNODC Regional Office for South Asia has been working with governments and civil society, as mentioned in the 6 countries of South Asia, providing technical assistance on challenges pertaining to regional security, crime prevention, justice, and health. The commitment to sustainable development goals, human rights, and the rule of law are the core elements of UNODC's mandate. UNODC is a long-standing and trusted partner of member states with proven experience and in bringing national legal frameworks in line with conventions, 3 drug conventions, the Convention Against Transnational Organized Crime, and 19 universal legal instruments against terrorism. It possesses expertise in evidence-based programming, integrated capacity building to various law enforcement and civil society institutions, and in promoting regional cooperation. With great pleasure, I extend my warm welcome to all of you, with a very special welcome to the Fourth Wave Foundation for convening this very important conference here in Cochin. Kerala, as a land of ports and center of international maritime trade, has always been historically the eclectic hub of global cultures, ideas, and thoughts. It is therefore only appropriate that an international consultation and discussions here are convened in this land on a very pertinent global problem, drug use. Ladies and gentlemen, drugs and their impact on health and security of people have become a major source of concern all over the world. All countries and regions are adversely impacted by drug use and trafficking, and people from all backgrounds are equally affected by this menace. According to the UNODC World Drug Report 2019, an estimated 271 million people, or 5.5% of global population aged from 15 to 64, have used drugs, while 35 million are estimated to be suffering from serious drug use disorders. Around 53 million people worldwide had used opioids. Globally, both the range of drugs and drug markets are expanding and diversifying as never before. So the dilemma whether the glass is full half or full empty is still on the agenda. Opiates, cannabis, and amphetamine-type stimulants remain the main substances of concern in South Asian region, with record levels of cannabis herb seized in Bangladesh and India during 2017. Yet, for people with drug use disorders, the availability of and access to treatment services remains limited at the global level, as only 1 in 7 people with drug use disorders receive treatment each year. South Asia, and especially India, are uniquely affected by the scourge of drugs. The region's vulnerability lies in its geographical position, as it falls between 2 major drug-producing zones or centers. These are the global triangle and the global crescent. It is a matter of great concern for all member states and for national security. The findings of UNODC's Afghanistan Opium Survey 2017 are very disturbing in this respect. Opium poppy cultivation has significantly increased, and traffickers are now supplying drugs around the world, even to extremists and criminal groups. This poses a critical challenge for law enforcement and health professionals. The southern route of opiate delivery, on which India is located, is being actively used by syndicates and is a direct threat to the people of South Asia. In addition, coastal states in South Asia are vulnerable to maritime trafficking as a result of their exposure to trafficking routes across the Indian Ocean. One more reference to UN studies and findings. According to the INCB Annual Report 2018, there appears to have been a noticeable growth in drug trafficking by sea in the Indian Ocean region. In India, several sizable seizures of heroin were carried out at sea in 2017. 6 tons in January. Can you imagine? 6 tons, and some 1.5 tons in July. In 2018, several vessels carrying large shipments of tramadol from India were intercepted by Sri Lankan authorities, while in 2016, police in Sri Lanka reportedly detected almost 1 ton, that is 900 and something kgs of cocaine on a ship bound for India, representing one of the largest cocaine seizures recorded in South Asia to date. Relations between organized crime and terrorist groups are also evolving, much like drug markets themselves. Drugs continue to represent a major source of revenue for organized crime networks, but business models are changing, with criminals exploiting new technologies such as the darknet that are altering the nature of the illicit drug trade and the types of players involved. New ways of delivering drugs further point to the need to involve other sectors such as postal services in the fight against drug trafficking. Unfortunately, our children and youth remain extremely vulnerable to drug use and crime. Children and youth are influenced by a complex interaction between predispositions and various risk factors, such as peer pressure, social norms, reinforced by harmful media messages, mental health issues paired with a lack of protective factors in the school or family environment, making them more vulnerable to initiate substance use or transition to dependency. Let us make no mistake, we are facing a real, genuine crisis, and our response must be urgent, swift, and resolute. But how? This is a very big question. It is not answered in many places in the world, and we are here to find out how to address this menace. So, ladies and gentlemen, here is the role of civil society into the forefront, which comes now. I believe that countering the scourge of drug use merits a strong and coordinated multi-stakeholder response that involves civil society, governments, law enforcement agencies, UN, healthcare, and professionals, and media. Without a doubt, we must reaffirm our support to balanced health and rights-based approaches to drug supply and demand that, most of all, put people first. The fight against drug use also needs strong support of social and healthcare departments by setting up scientific, evidence-based treatment centers. Prevention requires sharing resources and developing partnerships with NGOs and community-based organizations. Civil society organizations play a vital role in harm reduction, implementation, and advocacy at international, regional, and local levels. I'll repeat what Mr. Hornberg said about civil society. Well, without civil society, its full-fledged involvement in combating drug trafficking and use, well, it's really impossible to be effective in this fight. Civil society organizations play a vital role in almost every aspect, especially if we are talking about monitoring, evaluation, and impacting, people on the ground. Today, there are numerous civil society organizations providing services, promoting and advocating for harm reduction at the global, regional, and national levels. These include international and national non-governmental organizations, harm reduction networks, and drug user organizations. Civil society play, as I mentioned, a very significant role in the independent monitoring and evaluation of policies and programs, conceptualizing and initiating innovative solutions to social problems, mobilizing communities, implementing programs, delivering services, representing and advocating for the interests of affected communities, and consulting with affected groups. The effective implementation, and it was also mentioned by Mr. Hornberg, UNGA's outcome document and the 2030 Agenda for Sustainable Development requires a holistic approach that involves civil society at the local, national, regional, and global levels. I'm pleased to share that civil society organizations participated actively in the UNGA's 2016 preparatory processes, including through various regional consultations. Member States' recognition of the importance of civil society in addressing the world drug problem was demonstrated at the outcome document, where civil society is reflected 11 times in total. Member States are resolved to take the necessary steps to implement the recommendations in close partnership with other stakeholders, including civil society. Let me dwell on something related more closely to South Asia. In South Asia, NGOs have been actively involved in drug demand and harm reduction activities with knowledge support from UNODC since the past many years. Some of the areas where NGOs have been playing a vital role include awareness building through school interventions, prevention and mass awareness programs, and drug dependence treatment and rehabilitation. Ladies and gentlemen, let me share with you a few instances where civil society has created impact in South Asia. In Kerala, the Fourth Wave Foundation, through its anti-drug campaign, Project Vanda, has been reaching out to adolescents vulnerable to substance abuse. The campaign aims to address the root cause of drug use by redirecting the energies of children and young adults through creative and healthy pursuits. This culture of learning, empowerment, and acceptance when young people are the most vulnerable seeks to promote healthy and responsible behaviors. In Sikkim, Saathi has been a model intervention of NGO and government partnership. Sikkim, despite being India's smallest state, has a higher than national average consumption of alcohol and tobacco, with very high prevalence of substance abuse among children in both urban and rural areas. Here, the government and the network of NGOs have been working hard together since 2013 under the banner of Sikkim Against Addiction and Towards Healthy India, abbreviation for Saathi. Saathi's objective is to limit substance abuse and generate awareness among students, parents, school administrations and community about the health, social and economic implications of substance abuse. The drive lasting change in the behaviors of different layers of society, especially children. The initiative is anchored on a well-developed peer education model. So the SATHI program contributed in training the peer educators to provide the initial level of counseling. The peer educators understood how to initiate the discussion with their classmates who are in drug use and what methods to use to reduce and eliminate their use. UNODC has also developed the Global Family Skills Program. This is something absolutely new, brand new, and very effective in some states. We are introducing it in South Asia, which aims to strengthen family protective factors such as communication, trust, problem-solving skills, and conflict resolution that are relevant to their culture. It focuses on relationship and behavior changes and includes opportunities for parents and children to spend positive time together as ways to strengthen and bonding and attachment between the parents and children. The training module is being piloted in different countries, as I mentioned. Now it is in Bangladesh, with active participation of community groups and civil society organizations. Clearly, there are multiple areas where civil society stands to create tangible impact and support governments in addressing drug use. In a nutshell, following are some of the ways in which NGOs can work with UNODC and the governments in promoting healthy living and protecting women and youth from drugs. Ladies and gentlemen, providing support with parenting skills programs elaborated in the UNODC Family Skills Initiative. So supporting parents is being better parents in very simple ways. These are warm, child rearing style. Parents set rules for acceptable behaviors. Closely monitor free time and friendship patterns. Population-based interventions. These are reducing adolescents' interest in substance use by informing about the full picture with harmful effects on the drug and long-term adverse consequences. Introducing life skills education to manage curiosity, peer pressure, and stress. The third element is limiting the availability of substances to make them more difficult to obtain and use. School-based interventions. These are developing policies in line with international prevention standards and rolling out awareness campaigns like UNODC's Listen First campaign. Community interventions. Carrying out village-level activities, providing knowledge support to youth clubs, using sports recreation as a platform against drug use. Another area is support in drug use treatment, identifying adolescents who might be at risk or who show signs of problematic use and to reduce the use before it escalates. Ladies and gentlemen, I'll step aside from my official presentation and express my views gathered during my long work in the Organization for Security and Cooperation in Europe. This organization is famous for its involvement in development and implementation of systemic reforms in the countries in transition from centralized to market economies, from strictly controlled political systems to democracies. So this is about reforms, and I have certain experience in developing and implementing such reforms. So let us understand that we are facing a huge, humongous, global system of transnational organized crime, with its ramification in trafficking in drugs. So this is a system, and this system can be defeated only by a more effective system. So let us discuss how such a system can be developed. Well, there are certain elements, I believe, in such a system. First of all, we need to develop long-term strategies. Well, they are not in place, unfortunately, in many countries. These strategies should be complemented or followed up by short-term policies and action plans with clear-cut objectives and instruments, including mechanisms for monitoring and evaluation. They should be in place, and this is where civil society can play and should play its vital role. Then, if we are talking about a global or even a regional subsistence of transnational organized crime, international cooperation, very close and effective, and combination of systematic approaches at global, regional, and national levels should be also in place. This is also missing, this is challenging, and well, we need to discuss how to evolve it. Another element of such an effective systematic approach is involving all stakeholders. I mentioned, so these are not only governments, but civil societies, media, the private sector, and academia, of course. Then we need to understand that we can be effective if we equalize well, our combating both demand and supply sides. And in this sense, we need to understand what are the concrete pull and push factors. If we are talking about supply, so these are mostly pull factors, because the main factor is humongous, fabulous, well, incredible level of profit. So this is the main pull factors, and if we understand it clearly that this is a criminal business and it is about huge profits, we need to address financial aspects of trafficking in drugs. And this is not easily said, but well, not easily done. Because, well, even if you are talking about South Asia, all of you know of the existence of Hawala and Hundi systems. So these are networks historically developed, which are using now well sophisticated internet technologies. So this can be defeated only through the breach between civil society, which can be a source for information for law enforcement agencies, and developing networks of criminal intelligence sharing between different law enforcement and national agencies. So this is of utmost importance. Still, this is something lacking in South Asia. South Asia is lagging behind other regions of the world. For instance, UNODC has successfully established such a intelligence sharing mechanism in Central Asia, Southeast Europe, Middle East, in certain areas in Africa, and now in Latin America. Still, this is something pending in South Asia. So we have suggested, we had a project for establishing such a mechanism, and now the establishment documents are under consideration of the governments, and I'm pleased to note that the three governments of South Asia, namely Sri Lanka, Nepal, and the Maldives, have signed such documents. And as soon as the government of India signs, we can launch the second stage of our project and make it really practical. We need also to understand that while talking about systematic approach, we need to address corruption. In many cases, and this is also quite evident in South Asia, even well-developed approaches by law enforcement and even if good policies are in place, corruption networks make all the efforts of the governments void and null, absolutely ineffective. Notwithstanding huge seizures, we need to understand that the system, the structure of drug trafficking is still intact. And this should be discussed, I believe, at this conference as well. We do know that there are different approaches in the world in terms of addressing drug problems. The so-called soft and strict, and even harsh. It was mentioned. On the extreme side of it, are the approaches in the Philippines, for instance, where there is a well-known war on drugs. But one should understand that the immediate ramification of such a strict approach is a violation of human rights. And as you know, UN is against violation of human rights, and victim-centered and human rights-centered approach is the nitty-gritty of all UN policies. So in this sense, although there are different approaches in the world and there are some good examples of soft approach like the results of new policies in Portugal, for instance. But still, I believe that one-fits-all approach, is not acceptable. So tailor-made approach in every, region of the world, in every country should be pursued with full taking on board of cultural, historical, habitual and behavioral specificity of each nation and ethnic groups. So I do hope that this conference will discuss some of the points raised by me, and I wish you very productive, very fruitful discussions, and of course, it should be aimed at some practical, I would say, objectives like developing networking, sharing best practices, experiences, and building strong partnerships. Thank you.